could join us today. Sorry, so all I said was welcome. Assalamualaikum. But my name is Mehvish. I'm a third-year medical student at Southwestern, and I'm going to be your moderator today, inshallah. Okay, so before we get started, let's just, get ourselves in the right headspace. Do a quick dua. So Bismillah ar-Rahman ar-Rahim. Iqra bismi rabbika alladhi khalaq. Khalaqa al-insana min alaq. Iqra wa rabbuka al-akram. Alladhi allama bil-qalam. Allama al-insana ma lam ya'lam. So definition, or the translation, sorry, is read in the name of your Lord, who has created all that exists, has created man from a clot. Read, and your Lord is the most generous, who has taught the writing by the pen and has taught man that which he knew not. And I also just want to quickly say, let's just make dua that Allah accepts from us all the sacrifices we're making for our careers to help others, that he keeps our intentions pure, and then he makes us close to him in this blessed month of Ramadan. And with that, let's begin, inshallah. Okay, so let's start with what is AMWPA. So it's a nonprofit organization. It was founded in 2008, and it consists of female, mostly, physicians, dentists, allied health professionals, all working together to promote the health, welfare, and education of women. So already we've done a lot of stuff. So during the pandemic, we were involved in the community, providing masks, providing meals for frontline workers, and then also a really big thing is merit awards for female Muslim students as well. So I'm just going to introduce myself again, moderator, and then I'll let the others introduce themselves as well.
I'm Safiyya, and I'm a fourth-year medical student at Dell, and I will be going to residency in pediatrics at the University of Tennessee in Memphis.
My name is Manal. I'm at UT Southwestern. I'm a current third year. Inshallah, I'll be applying for OB-GYN. So excited to be here. Thank you for having me.
Awesome. So Let's get started. Manal, you want to take it away?
Alrighty. So the purpose of this presentation essentially is to give y'all a good idea as to what you can expect for your clerkships. Like I know a lot of people, especially the second years, are just right now transitioning into their first clinical rotation. So I will just say, obviously, rotations will vary from day to day, like the responsibilities, the workflow, your expectations around notes, and please mute yourself if possible, if you're not speaking. So yes, expectations around notes and presentations. Those are all going to shift depending on not just the service, but also the attending and their style. Mev, are you co-host of this? I think if you are, you can mute them. All right. In terms of setting expectations, so I think generally it's a great idea. The first day that you start on service, you ask your chief resident and your attending for the expectations. So expectations including when you want to show up in the AM, and this is more relevant with your resident than with your attending. Your attending will tell you when they start rounds during the day, but your chief resident will be able to tell you like, hey, this is when we show up, this is when we start pre-charting. They will also be able to tell you what sort of notes they like. The residents can share any sort of templates, tell you when the attending wants you to submit them, either pre-rounds or after rounds. And y'all can also discuss presentations. So are there any specific styles that the attending likes? Do they prefer for you to be more brief or more detailed? Are they okay with you having your note out, your notes or your phones out during rounds? Some attendings honestly will ask you to freestyle, and that's kind of nerve-wracking if you're not prepared for that. So definitely get a sense of what their expectations are. And again, even if it's the same service, attendings will have different preferences. So just get a sense from the residents. They've been working longer. Sorry, I don't know if I finished that slide, but anyhow, yes. So with a general inpatient service, there are days when you will be admitting new patients onto the service. So have an idea of what that schedule is. And on those days that you're admitting, whether that's every day or not, you as a med student, you have to be prepared not only to follow up on your old patients, so the ones you're already following, so making sure that you have all their overnights events down, all their new labs, etc., but that you can also get ready for the H&P for any new patients that you're going to admit that morning. So it can kind of feel somewhat chaotic sometimes if you are already carrying like 3 patients and then you have a new H&P to do that day. So just be prepared. Just ask them again, like when they admit, up till what time they admit, and then after that, when they like to staff. So this is when you actually do the presenting of the new patients to the attending. And typically that will be in the afternoon. It might be on rounds. That's why it's a good idea for you to have a sense of that. So how long you need to take preparing your presentation for the day. And then finally, talk about grades. Like obviously you're there to be graded. You're obviously there to get the highest grades that you can. So it's totally reasonable for you just to ask the attendings, just to ask the residents what they're looking for and how you can meet their expectations. In terms of dress code, I know this could be nerve-wracking. So when you're in an outpatient setting, generally you will want to be dressed in business casual while wearing your white coat. As med students, like it's totally okay that you don't have like the most exhaustive wardrobe. I just invested in a couple of like slacks and just like blouses that I can alternate. And again, just got them like off of clearance or like the factory warehouse or whatever. And it works for the rest of the year. So don't overthink it. Just whatever you're comfortable in and whatever works. In terms of inpatient services, typically you will be allowed to wear scrubs. And I like to wear my jacket, which has a lot of pockets because I like to keep snacks in it. And then when you're on your surgery rotation, having a jacket with pockets will be really useful, just like so you can have like supplies at any given moment. But typically they tell you not to bring them into the patient's rooms and like, whatever. They try to keep it as sterile as possible. But I still would have like wound care supplies in my pocket. That's okay. All right.
And then Manal, I just wanted to ask if you could add a little caveat about specifically being hijabi and navigating scrubs, like hospital scrubs and having to wear that and how you guys approach that.
Yeah, that's a really good question. So, okay, let me step back a bit. Hospitals will typically provide you scrubs. And so make sure, like, if you don't want to pay for your own, you don't have to. You can definitely just use the schools or the hospital scrubs. They get the job done. You don't need the fancy figs at all. As a woman who wears and practices the hijab, it is like, especially on your surgery rotations, you're going to have to scrub in to the OR at some point. And so that means your arms are going to be uncovered. That's something you just have to come to terms with. At first, I felt uncomfortable. At first, I was like, oh my God, everyone's staring at me. Everyone's staring at my arms. I will just say, I don't think anybody cares. Like, no one's looking at you and your, at least my scrawny arms, like no one's looking at them. As long as you're getting the work done, that's most important. In the OR, they do have like these sterile jackets that you can wear, that you can actually wear into the OR rooms. And so you can ask the nurses for those. But then again, like, as I said, it is going to be a bit awkward at first to be uncovering your arms to scrub up to like beyond the elbows, but that's like, it's just something you have to get used to, and it's okay. And again, this is all for a lot, like you're taking care of patients. And then finally, in terms of like what I wore on top, I was okay with wearing like my hijab in like a turban style. I know some ladies choose to do that, some people don't. That was really easy for me to slip underneath like one of those sterile scrubs caps. I know that you can get like the covers that covers the whole thing. You may just have to ask the nurses for that. They might not have it as readily available as the other ones, but definitely doable if you need that accommodation. All right, so your daily workflow. And again, this is kind of like an inpatient service. So this might be your hospital medicine, this might be your neurology inpatient, pediatrics, etc. So typically you will come into the hospital, depending on when you round with your attending, around 6 a.m., 7 a.m. That's when the residents will get there and you do your pre-round. So what I mean by pre-rounds is you're going to check up on all the patients that you've been following. So check up on their overnight events. I'll talk about it more in detail later, but like labs, results, anything that's happened overnight. And that's when you see your patients, and that's when you start to create a plan and discuss that with your residents so that you're prepared to have like a prepared presentation for your attending when it comes to rounds with them. And so once you have started your notes in the morning, you typically just kind of see your patients and then wait for your attending to show up. I like to have my notes like pretty thoroughly started just so I'm not scrambling to do them in the afternoon. Maybe like obviously you don't have your plans solidified because you're going to probably change them during rounds. So you can always pen your notes and then come back to them after rounds and sign them then. And then around 9 a.m., 10 a.m., that's when your attending will show up, and then you just run the list. And some attendings, again, will prefer like table rounds. So that's like when you sit in the workroom and you just talk about the patients and then you go see them together. Other attendings will prefer like bedside rounds. And that means you go to each patient and then talk about them in front of the patient. So it's a different kind of exercise in the sense that your presentations have to be very concise and easy for the patient to understand. So it's a challenge for you to be able to translate all that medical knowledge and jargon into something that the average person will understand. There's also, like, generally during rounds, this is the time when you can show your attending like how you interact with patients. So one thing I like to keep in mind is that this is like your opportunity to do a lot of patient education. So I like to take time with my patients when we're talking about them, about the day-to-day plan. I give them an idea as to the sort of workup we've already done so far. Why did we pull the labs that we did, the imaging that we did? What were we looking for? What did all those labs and results actually show? Did they show the thing that we were worried about? How does that impact your plan? How does that impact your patient today? Obviously, you don't have to go detail by detail. They don't need to know what their sodium levels are that day, but you just want to give them the information that's going to be most critical to making the decisions that you do that day. And then finally, after rounds, you typically submit your notes, and then you may have lunch or noon conference. And then in the afternoon, make sure your notes are done, follow up on any patients. You typically run the list with the residents, see if that there are any tasks that you need to do left over, and then eventually you just leave. And so a hospital inpatient service, typically you'll be done by 3-4 p.m. in the afternoon, and then you have the rest of the day off to study and catch up on everything else you need to do. Okay, sorry, I know we're running low on time. So navigating an epic, as I mentioned, this is during your pre-charting. You want to check overnight vitals, like flag for anything abnormal. If someone's fevering, check if the fever curve's improving. Have there been any blood pressure spikes, tachycardia, etc. You want to, as a med student, you have to be on top of all the medications your patients are taking. You probably know these medications better than your residents do because they're carrying like 6-7 patients. You're carrying 2 or 3. So they're going to expect you to know those meds like detailed. And then also check how often they're getting. Are they getting their PRNs? How many times are they asking for their PRNs? Yeah, if someone wasn't given med, ask why. The event log, I have screenshots of Epic coming up, so the event log will be able to tell you like in a detailed time frame as to what's going on day to day. And then also update yourself on all the notes from overnight. Read the nurse notes. They often have a lot of information around pain, around like vital signs, just like also behavior around the patient. Like it's a good way to get some insight. And then obviously look at labs, tests, imaging, ins and outs. It really depends on your patient. Like, what are you caring for them? Oh, like, what are you managing for them? Like, is it like a small bowel obstruction or what have you? So look at ins and outs, drains, lines, etc. So I will probably just skip over these just because this is like very Epic specific. I don't know if everyone uses Epic, but like if you guys want more information on how to navigate Epic, you can reach out to me. You can message me in the chat, or I'll drop my number as well, and we could talk about like what are some ways to make it more effective for y'all. But Mev, you can skip over these screenshots. Thank you. And that's all from me today, or right now.
Okay. So this is, I'm going to talk a little about taking notes. So this is not just the clinical notes that you're right that will go into chart, but also like when your daily, like when you're talking with patients and you are trying to capture what they tell you. I guess the 3 most important things, you can decide as a med student going to Clerkships if you want an iPad versus a paper. Most people, I use just paper, but I did have some classmates who solely pre-charted, and also like as they interviewed patients, they used an iPad and it worked for them. The second thing is, especially early on, when you start your rotations, you're not going to be able to remember everything that they tell you. And I think one part of that also is because as a med student, you don't have the format and the structure in your head drilled in like a resident does. So I think it is helpful to write down during your conversations in the mornings and the afternoons when you're taking histories, write down what the patient and their family is telling you, because you're not going to remember it. There was one incident I remember, like whenever I was, a nurse had called me, and she asked me to pass on a message to the resident about, and she mentioned the room number, and I didn't write down the room number thinking I would remember it, but I did not remember it. And I was telling the resident, I was like, wait, it's 208. No, wait, it's 248. Wait, and I went back and forth. It was so embarrassing. But just my lesson here is write down everything, especially when you're getting communications and calls between, if you're speaking to attendings and nurses. The last thing, charting is definitely something that like you may or may not have to do at your institution. It's a valuable skill to have, I would say, before you start residency. But you do get the hang of taking notes and like writing notes and putting the chart. There's two things that I wanted to share. As you're starting out, you can choose to get an H&P notebook. I did not, or I bought one, but then I never used it because I just thought it's just much more efficient to use printer paper, and then just be able to recycle it at the end or shred it. The second thing I want to say is the fishbone diagram at the top right of the screen is definitely something you want to know before your first rotation. Don't be like me and write like NA, CA, MG, CR, and then like write in the numbers next to it as in a list. Like this is much more efficient. You'll be able to like read your notes much better. I even know one of my, actually even my first rotation when I didn't know, I would, actually I can say that later, but yeah, next slide. So for presenting, there's some common pitfalls that I made, that we all make, and that you will make also. But the first thing is disorganization. For me, that was, I knew the structure of a patient presentation, but as you are starting the presentation, you kind of forget. So then even when I was in the subjective, like I would start talking about the vitals. And whenever I was in the vitals in the objective, I would be like, oh wait, I would remember something I needed to say in the subjective and I would have to say it. I do think it's just better to just like, the attendings will appreciate if you are able to, the earlier you're able to like synthesize and like really like focus on like the organization of a presentation, but it's a common pitfall that a lot of us do make. The next thing is inclusion of extra info or exclusion of pertinent info. And I was going to say earlier is that when I first started, I thought every lab value is critical. So I would be presenting and I would be like, the sodium was this, the potassium is this, without it. And then it's as you gain more experience, especially at the end of your clerkship year, especially in your fourth year, you'll be able to understand and what's important and what's not. That's just something to keep in mind. Why medical student presentations are a little bit longer, but it's okay. And then the third thing is a failure to build an argument. So this is another example where I had an overnight shift at the pediatric cardiology ICU, and I knew it would be my job to present in the morning my patient in front of rounds, in front of the entire peds cards ICU floor. And I remember I had this awesome, like I literally worked so hard on my presentation, like what happened overnight and all the labs, everything, the vitals. And then like at the very end, the attending, he was like, okay, so what's your plan? And then I was just like, oh God, I didn't think about it at all. And then I just made up something like medical students usually do. And it was wrong, but that's okay. I learned. But yeah, I always try to keep in mind that you will be asked, and you may be asked, what's your plan? And then we'll talk more about that later. Other things, eye contact are important to keep the audience engaged. Try to maintain as much eye contact as you can while presenting as reasonably possible. Be concise. And then research and preparation. I think before you start a rotation, like for example, MFM, for example, is very overwhelming. Go over like what the aspects of an MFM presentation are the day before, and then you'll impress your residents. And also do good presentations and have good patient care. Next slide. I think the most important things I want from collecting history is keep in mind of differential before you go see your patient, and even after in your presentation, try to think of the 3 to 5 things that this could be. Don't fall into the trap of zeroing in on a diagnosis. Always think of other alternatives, especially when something doesn't add up. one good question to ask is why are they specifically here in whatever service you're on? For example, if you're in the ED, why are they in the ED? What made them come to the ED? If you're in the ICU, why are they specifically in the ICU compared to just being on general floor? ROS, I always ask chest pain, shortness of breath, abdominal pain, nausea, vomiting, and diarrhea. The thing that's in red, you will commonly be asked at the end of your presentations, what about this? What about this by the residents and attendings? If you don't know it, if you didn't ask, it's very important to just be honest and say so. Believe it or not, like this conversation is not just at a medical student level, it's also at a resident and fellowship level, where if there is a trainee that sometimes trainees, if you always have to be cognizant at every stage of your training to never falsify or make up information. Yeah. Next question or next slide. Okay.
All right, so I can cover this. So this is kind of more detail on everything we've been alluding to, like what is a presentation? Like, what am I supposed to say? So these are all the different aspects. So first you start with your one-liner. And I don't know if you guys are familiar, but it's like, this is a 54-year-old female here with chest pain. And they have a history of hyperlipidemia. So you're putting the pertinent information just straight off the bat. What do you want your attending to know about this patient going into your presentation? After that, you want to touch on the history. So, patients will tell you a really long story about how their second cousin once removed had this family history of whatever. What you want to do is take all of that information that you're being thrown and kind of summarize it concisely into medical language. So if they're like, I've been itching for 3 months, I don't know what happened, it itches here, it itches there, you want to be like 3 months of pruritus. Because your attending has a short attention span and you are kind of the filter. Think of yourself that way. And then after that, you talk about the review of systems. So this is where, okay, if they're presenting with pruritus, well, they don't have a recent history of new products or something. It's kind of like you're going through all of the different systems, but you're really picking on things that are this is for my argument, or maybe this is against my argument. And always think about pertinent details. And in the back of your mind, there should always be an argument running. And then after that, you can mention medical, surgical, social, family history. I would say most attendings prefer, if it's pertinent, say it. If it's not, don't. You don't have to tell your attending about how they have 3 family members with a history of some random cancer or something like that. It's not relevant to the presenting problem. After that, physical exam findings. I know some people like to go through and say all of them. I think honestly, most attendings prefer a focused physical exam. And again, you'll get better at this as you go along in your clerkships. The expectation really isn't to have all of this hammered out in the beginning and absolutely know what's pertinent. So I think it's better to be more thorough than not, but try to think of the goalpost as being, I'm going to say the things that are pertinent eventually, and you don't have to be perfect at the beginning. And then finally, you have your assessment, and I'll touch a little bit on the plan later. So again, you're just going to restate your one-liner a little bit. Just say, this is 50-year-old female here with this, based on this lab of, this is their white blood cell count based on this physical exam finding that I saw, based on this thing they mentioned in their history. And really, this is where your argument happens, where you're look at all these things I've already told you, and I'm putting it all together to tell you that I think this is going on. And remember, you want to be confident. You could be wrong. It doesn't matter. You have no responsibility here, but stick by it. And make a decision and be really firm on it about what you're going to say. And obviously you will be corrected, and you get to take that and you take it as a learning point. And then here, if there's multiple different things that could be going on, for example, you just met the patient, so it could be 1, 2, 3, 4, 5 things. Then for each of those different things on your differential, you can put different pieces of evidence that you found, but always have a way of saying, this is what I think it most likely is. So this is number 1 on my differential. And then try to remember, if there's an emergent condition that you're listing in your differential, oh, I think this patient might be having a heart attack, and it's number 4 on your differential, know that you need to disprove that, and disprove that they don't need to be taken to emergency services right now. Because I know that's a mistake that a lot of medical students make, where it's if this is really an emergency, then, oh, okay, we probably shouldn't be here casually chatting. Okay. And so that was kind of the H&P. So I can touch a little bit on SOAP presentations, which is kind of the acronym that we use for follow-up patients. You know, they're in the hospital, you see them every day for a week, they're assigned to your team. So everyone kind of knows them. And for that reason, you can keep things shorter. So SOAP stands for subjective, objective, assessment, and plan. So subjective, you go see them in the morning. So you're like, okay, this is a new event that happened. They denied their meds last night, or they have a new presenting symptom of abdominal pain. That's what they told me this morning. And then objective is like your physical exam, like, okay, they had no tenderness, even though they have abdominal pain. Maybe they were febrile last night. You definitely want to mention something like that. And then maybe some new labs and imaging that you may have seen as well. And then assessment is pretty similar to the H&P. You talk about your argument. You know what? I think this patient is stable, even though they say they have abdominal pain. Here's all my reasons why. And then plan is you want to include all the problems that you're managing. So a lot of the times, many patients will have like psychosocial things going on. They'll have like a history of diabetes, and you're still managing their diabetes. You're still managing their hypertension. So you want to include that in the problem list, even if it's not the main problem. And then suggest recommendations for each. So that could be, you know what, I want to get a MRI of this patient's abdomen. This is why I think it's indicated. Let's consult GI, you know, that sort of thing. And then summarize what you're doing already. And then definitely when the patient is about to leave, you can always do this, but definitely when the patient is about to leave, really think about what the barriers could be to discharge. A really big problem that attendings deal with is the patient will be there and all of their medical stuff is taken care of, but now they're stuck in the hospital with like a $20,000 a day bed because we forgot to like have PT clear them and it's the weekend now. You know, like some of those things can be really frustrating. So really in the back of your head, always be thinking about what does this patient need to go home, because that is the goal. And then real quick aside on the plan, this is something that I struggled with a lot. I know a lot of medical students really struggle with this. You don't have the experience yet to excel at this. It's okay if they're not the best. They tend to, you know, say medical students are the history takers and the information gatherers. And eventually, you know, it's really the resident level that you're just really good at coming up with a plan. So the best way to combat this is talk to your resident, have good communication with them, be like, here's the plan I came up with. And they'll be like, you know, let's maybe do this instead. And that's really helpful in front of your attending. And if you are going to suggest something, try to back it up with research. So like when someone questions you, why do you want to do that? You're like, well, this meta-analysis, whatever. And that's like super impressive. And if your attending is like, nope, we're not doing that. That doesn't make sense. Say why, and ask them to give you their insight and whatnot, because that will really impress them as well, even if you're wrong.
Okay, so this is just some general notation. Oh, go ahead, Manal. Okay, this is just some general before we go into more specific. It can be a good idea during the week you're on service or any week to offer to do a presentation. Whenever you do a presentation, make it useful for the residents and think of what could be helpful to them as well. The second thing, it's also important to know your patient the most. As a med student, you'll have one patient, max two, and so you'll be able to delve into their chart and also be able to spend a lot of time with them in the afternoon, much more than a resident can. And I do think, as I lived with another med student, and just hearing her stories about what she was able to do for patient care because she was able to spend so much more time with the patient was really inspiring. And that's one thing she told me. She was like, you know, it is, as med students, we do have more time compared to residents. Some other things that you can do that can be helpful are writing notes. It is a requirement at a lot of med schools and rotations, but don't underestimate how helpful it is as a resident, for a resident to have, like, you know, even just one note done for them every day. Discharge summaries are not really something that med students are expected to do, I would say, as a fourth year level, but as a second year, maybe towards or third year, as you're on your clerkship rotation year. So Dell does everything in their second year. That's why I'm a little bit confused. But your clerkship year, towards the end of it, you may be offered, like, just to be helpful, but it's definitely not an expectation. Something you can get an interpreter if needed. Speak to the nurses in the morning and the afternoon. Don't underestimate them, like how valuable it is to speak to the nurses. They can also teach you a lot. The thing in red is ask for feedback from the resident or attending midway during the week or the months that you can improve. Next slide.
So now we'll be moving on to more rotation specific advice. In terms of your OBGYN rotation, so it typically will be split up into kind of like an L&D kind of rotation. Then you'll have your gyne weeks, and you might also have some outpatient time as well. During L&D, it's a chaotic service in general, just because so many women are coming in. Make sure you introduce yourself to each mom. You can be swept away by how quickly everything moves, but like imagine it's such a vulnerable, intense moment, and just like this random student is coming into your room to look at your vagina. That's terrible. Like honestly. So introduce yourself to each mom, spend time with them, talk to them, get to know them. This is such a special moment that you get to be a part of. Get yourself familiar with the ACOG screening guidelines. It'll come up over and over and over again, also on your shelf exams. And then finally, familiarize yourself with birth control. You're going to counsel women on them, even if they're not like actively trying to not have kids. It could be for whatever reasons. And again, this will come up in so many different rotations, and you can look like a superstar talking about birth control in like a medicine rotation. Finally, surgery. Super brief presentations. Like honestly, I don't even recall like doing a presentation longer than like a minute or two on surgery. Like the attendings, for the most part, I even just like presented to residents for the most part. So it's just like keep them really brief, just like I's and O's, white count, drains and lines. Are all those looking good? Cool. Yeah, we're out basically. Post-op milestones. So things you're looking for: is the patient walking? Are they having bowel movements? Is there any sign or symptom of infection? And then be ready with wound care supplies as a med student. I would look at the list beforehand every morning and just like familiarize myself with what sort of wounds the patients had, and made sure before rounds that I had like a bucket full of all that stuff. And then finally, for neurology, this is a really fun rotation, honestly, just because the neuro exam is really fun. Also, the residents, they love to show off all their fancy tips and tricks for like getting a cool reflex or looking at the eyes or whatever. So just like, I think once you finish med school, the expectation is you know how to do a neuro exam. But honestly, this was one of my first rotations, and I like hardly remember it all. So just try to get it solidified in your memory by doing it over and over again. And finally, always for any rotation, make sure you look at whatever imaging that y'all are discussing. Like it's such a useful tool to have. Like no matter what you specialize in, you'll be looking at imaging, and especially in a specialty like neurology, you'll be looking at a lot of MRIs and CTs, and sometimes you don't really know what you're looking at. But again, it's super helpful to have those skills, so definitely do that.
Okay, I can talk a little bit about these rotations. So psychiatry at most schools tends to be a pretty relaxed rotation with good hours. The people you're working with tend to be a little more understanding of your time and understanding of you. But that doesn't mean that this rotation is necessarily easy, because it can be emotionally taxing. You're going to be confronted with some of the worst things that happen in society. And so try to use that free time, if you have it, to take care of yourself emotionally. I also found the history taking portion a little bit challenging, because these interviews tend to be a lot longer than other specialties, and you're talking about really heavy stuff. And so make sure you're practicing that and asking your residents for feedback as well, because this is going to help you in every single rotation to know how to navigate this stuff. And then internal medicine. So this is a fun rotation, but it is a lot. It's the bulk of your clerkship training, really. It's kind of what most medical schools are really focusing on. And a lot of it is the basis for step 1. So this will just keep coming up over and over again on step 2, step 3. It's just going to be there. And it'll be on a lot of other shelves too, like the surgery shelf and whatnot. So really big thing that attendings value is like evidence-based methods, pulling out the research, saying, I looked at this journal. And this is where I really encourage you, like your attendings may be busy, but you're paying to be there. If you need to ask for their time, ask for their time. Don't be scared to do so, and try to connect with your patients as much as you can, because you really see people going through some difficult stuff. And I know that you may not know a lot medically, but you can do a lot emotionally and just spiritually, and being there for them.
Okay, so tips for pediatrics. It's like, just remember, it's like internal medicine for kids. If you have internal medicine first, it's a lot of very similar themes when you go to the pediatric side. One thing that I struggled with on pediatrics was my pediatric clerkship was like, this is a rotation that we were working primarily with the parents and communicating with them, and also speaking to the parents in front of the entire team. Definitely something that just needs gets better with practice. So things that are helpful to look up are the AAP clinical practice guidelines, whatever is free. And then even on the family medicine side, the AAFP clinical practice guidelines, I think are pretty free and they're very good. Family medicine is also like the most kind of like applicable rotation to our daily life and just like our maybe complaints that our family or friends might have. So I think it's important just like in your learning to really learn from like the plans that your attending says for specifically the family medicine outpatient side. Work on being a patient in the room. Each encounter should be around 20, I guess 30 minutes when you're starting out and then 20 minutes as you go down or as you go forward.
Okay, so this is a really important slide, so I'm just going to spend a little bit time here. I just want to say, starting off, you will be very overwhelmed. Sometimes there will be people, and through no fault of your own, that are going to expect you to be perfect. You're not supposed to be perfect. You're in training. You're not supposed to know everything. And just remember, every step of this process, you are enough. Sleep well. Try not to sleep 4 hours because you want to stay up and watch TV or something. I know that can be tempting, but it's a marathon and not a race. And trust me, you're going to feel awful if you just keep doing that to yourself. Eat well, have snacks, have granola bars. I always had a granola bar, especially on my like surgery rotation, just like tucked away. Otherwise you'll like, just be doing fast, which could be a good thing, just like in the morning, just like make the intention to fast, and it'll probably be pretty easy because a lot of the residents don't really eat. Try to exercise when you get home. For me, I had to give up a lot of my like group exercise classes and some of the other things I did, but I would like be able to go for a 15-minute jog, and that's all I can manage, and that was still really important. And have good company. Try to have company outside of med school. It can become like a bubble, and it can become an echo chamber, and especially if people around you are a little bit miserable, it can just kind of like add onto each other and make you feel bad. So make sure you're in spaces that are good for you, and that includes faith-based services, and like going to those lectures and going to hang out at the masjid and like go to those halakas, because that can like really help as well. And on that point, I, in some of my rotations, really struggled to like keep up with my prayers. For example, like on my surgery rotation, like there would be like a 12-hour surgery, and I was there from the beginning until the end, and it's like now already Maghrib. And so like that was something that was like really hard for me, and I ended up just doing like traveling prayers and doing what I could, doing when I could. And Allah understands what you're going through and how difficult this is sometimes, but just try to keep on top of those things and not let those fall short. Therapy and student mental health services are always a good option. And whether someone is watching or not, do good by your patients. It doesn't matter if your attending will see what you did for someone, but it will matter nonetheless. And if Allah loves you, the angels love you, and the people who matter will love you. And try to remember that, because you will be confronted with a lot of different personalities. And at the end of the day, it will affect you, and you just have to say it really doesn't matter.
Can I add something here? I just want to say, especially like your clerkship year, I think it's one of the most challenging years in the sense that you'll feel really isolated from people who are not in medicine. And I know Mev mentioned making sure you invest in relationships with people outside of medicine. I think that's a really good point. And at the same time, like understand boundaries too, in the sense that like your life is fundamentally different from your friend who is working a 9 to 5 and has vacations and can just book a trip to like Puerto Rico or Hawaii or something. Like I really struggled with that myself. And I think it's just being in the mindset, like this is something you signed up for. This is something that inshallah you have your heart in the right place for. And it's not forever. It's for right now. Allah is rewarding you for all of the efforts that you're putting in. And right now, the best thing that you can be doing is investing in your education and investing in this, honestly. Like this is a sadaqah jariyah, like this is going to continue into your career. You're going to help so many people with this, inshallah. So really invest in it and try to do your best. But also like don't make it a toxic thing where it's like medicine is only your life. Like it's definitely a balance of all things for sure.
Yeah, I left my own personal bits of self-care in the chat advice. As far as shelf, UWorld for every single shelf. And then Anki is something Some people use it, some people don't use it. I think that it's one of the best ways to to make stuff stick in your head. So when I was studying for dedicated, it was amazing how well, I mean, actually it was only stuff I learned through Anki that could really stick in my head. I love Anki. I'm a big Anki proponent. I'm still going to use it in residency, inshallah. At least that's what I think. But anyway, so I think those two are set you up for every single shelf. Just some other rotation specific, OB-GYN, APCO, UWISE questions were, I think, decent, but especially the videos on YouTube are very helpful. Next slide. Specifically for OB-GYN, could you go back for one slide, please? Yeah, specifically for OB-GYN, there's a procedure ready OB-GYN podcast that I listened on my way to the hospital, and it was very helpful for me. Next slide. I'm just going to go through some resources that are helpful for me for each specific shelf. Surgical recall was helpful for pimping questions in the OR. Pastanas, I didn't really use. I don't know why I put that there, but some people used it. D. Virgilio is an excellent surgical textbook. I also personally did never use it, but because surgery was my first rotation, I was just like trying to survive. But aside, I've heard a lot of surgical residents highly recommend D. Virgilio's. Next slide. Psychiatry first aid for the psychiatry clerkship I thought was helpful. Next slide. Peds, BRS pediatrics. I didn't really use it. I heard it was helpful. Internal medicine. I was just struggling to survive and pass that shelf, and I barely passed by a few. Actually, I don't want to say my score on the screen, but anyway, UWorld is very helpful because I think there's like 1,000 questions in the question bank for internal medicine, so that's more than enough for not only passing but even honoring if you know the UWorld very well. And family medicine, the AAFP Bank and the vaccine, and knowing the vaccine recommendations are helpful. Next slide.
Okay.
Or I think that's done.
So now time for questions. You guys can drop it in the chat, or if you want to say it out loud, you can as well. Wow, you guys are super prepared for clerkships. Okay. Well, if there's really no questions, we can give you back 15 minutes of your day. We're going to drop our information in the chat. So, oh, looks like we have a question. Okay, how did you guys go about choosing electives?
Okay, so Mev and I, we just did our 4th year planning. Personally, when I'm looking at electives, I'm just, depending on when I'm trying to take them, I think I'm trying to balance, like, do I want to do something that's really intense and time intensive versus maybe I don't need all that extra work on my plate. Like, I think I just want to chill. So I think it's a bit of that. Research, if you want to do more research, take a research block. It could be remote. That could also be a way for you to get in some downtime. And then finally, honestly, like, electives are a great way for you just to expose yourself to other aspects of medicine. I think the thing about medical school, especially here, is that the core clerkships are actually fairly limited, and you won't be exposed to all the specialties even within each clerkship. So if there's something that's kind of niche that you haven't really seen much of yet, I would say go do the elective in that and really get a sense of, like, maybe this is something you'll consider. It's honestly really sad that we don't have the opportunity to go do opto or anesthesia or anything like that. But yeah, those are some things I was thinking of when I chose elective.
Yeah, adding to what Manal said, I would say early on in your clerkships, if you have the opportunity to take an elective or take extra vacation, I would, in retrospect, in hindsight, I would actually think that taking the elective is better. You will get vacation, your winter break, maybe your spring break, your summer, but taking an elective is better just in terms of deciding what to do and just needing help deciding what to do, and also having more time off in your 4th year.
Yeah, I don't know if you should follow my advice here, but I was just really tired. I needed a break. I just took a research elective, and then I went to Costa Rica for a week. And that was what worked for me. So I still figured out what I want to do. So, like, it'll be fine. Inshallah is my point. You don't have to do everything perfectly. And then we have another question, UWorld and Anki. Yeah, I'm sorry. I feel like third years and fourth years tend to do this a lot, where you just say things and expect people to know them. So UWorld is a question-based software. If you've already taken step one, you're probably familiar with it, but basically it's just practice questions. I believe that there's a lot of discount codes available through your medical school and a lot of groups. So when those are available, I would really recommend getting them. They also come with practice tests for step two, and you can activate that whenever you're ready. Anki is like a long-term learning software. You basically download it on your computer and then you download Anki decks. And honestly, I don't know where people get them from other than Reddit. So you literally just search on King, which is kind of the big, massive Reddit deck that everyone uses. And then in using the browse function, and this is something that you can Google and look up on YouTube as well, you can unsuspend certain cards based on whatever you're learning. And so at the end of the year, you have this whole deck of things that you can use. Yeah, Cheesy Dorian was great as well. I used that a little bit as well. So I hope that answers that question. And then next question, how did you go about asking for a letter of recommendations? Is there anything you did differently for a specialty you were interested in?
Okay, I can take this one for a little bit. In your AIs, when you're really focused on asking for letter of recs, at the beginning of each week when you're working with a new attending, ask them on the first day, let them know that you're an AI, you're interested in going to a specialty, and that you may be interested in getting a rec letter from them. And then so that they are able to keep that in mind throughout the week as they work with you. And the very last day, ask them for a rec letter. They'll either say yes. If they say no, it's fine. You can move on to the next week, but basically that. Some people did get rec letters from their clerkship years. Not essential because you are able to get rec letters from your fourth year. But if you have a good relationship with an attending, and you can get a rec letter from your clerkship year too. Last thing. Sorry, I was gonna say you can even ask to work with them again in your fourth year, like just so they can remember you a little bit better. And yeah.
Yeah, that's all really great advice Safiyya mentioned. The only other thing I would add is ask for feedback and expectations often. So if you have like several meetings in the beginning being like, am I meeting your expectations? What can I do better? Blah, blah, blah. Then like, not only will you have a better relationship with them and be closer to them, but also like you'll be doing the things that they want you to excel in and impress them. And it'll all be like stuff that they can put on that letter of recommendation. And I would say, like, if you can, like, offer to go the extra mile, like do a presentation on a topic, that's a really easy thing for them to comment on. Like, give them an example at the end of the rotation feedback of like how you really engage with a patient or something. Like, go the extra mile, but then make sure they're also seeing that extra mile as well, and make sure that you're making that known. Okay, what was y'all's favorite part of third year? Thank you for the question, Faria.
Honestly, I think it's just the patients. Like, I was part of the pandemic class, so I'm sure you can also relate to this, but moving out of like that pre-clerkship phase where we were mostly virtual and finally actually engaging with a real life patient and like, doing an actual physical exam and getting to talk to them and getting to know their families and all. I think that was the most rewarding aspect. And then also I really enjoyed being in the OR. I feel like that's such a cool environment. And it's like, I don't know, like in medicine, we get to see things that like the average person does not. We get to see and experience these things. And I think that's why third year has been such a blast, honestly. It's just that like for this full year, you just get to pretend that you're like a mini doctor in each of the specialties you go into and to each of the core clerkships. And that's why, although it's like really hard to navigate, like, oh, they're evaluating me. On the other hand, it's like this may be your last opportunity to really see and experience and be this kind of doctor. And so for me, it was just like a really fascinating learning experience when I could think of it that way, honestly.
Yeah, I think my favorite part, so I feel like the year was challenging for me, definitely. I'm not gonna lie, but I really like the person that I became in a lot of ways as a result of it. Like, I think I'm quicker on my feet. I know like what to do. Like, I can handle an emergency better. Like, I can stay calm in situations. Like, I if someone says something to me that I don't like, I'm like, it's just so much easier to brush it off now. Like Manal says, like you are exposed to so much, you grow so much, you come out kind of a different person at the end of it. And I think in a lot of ways, especially if you're like able to process it in a good, healthy way, that can be really a good thing. And it can benefit you a lot in the long term.
Yeah, my favorite part was just like getting to do some rotations with my classmates. Like you get close to a lot of different people just because you're working with, for example, in 1 or 2 med students for 4 weeks straight, and it can be pretty fun.
Yeah, especially those like overnight or 24-hour shift rotations, like surgery and stuff, like y'all will become best buds, and that's like a bond that cannot be broken. And I think it's really special and cool.
Also, y'all will be okay no matter what the eval is, no matter what, you know, your shelf score is, inshallah. Like it all just kind of works out one way or another. And I think one of the things that like I walked away from this year realizing is just that, like, you know, an attending is just gonna have their own opinion of you, and so is a resident. Like they're just gonna, it's subjective. It's not actually really grounded in any sort of reality. Like they don't know you, they don't know your life. For the most part, they don't really, you know, they're not that invested in you beyond just in that limited time that you have with them. So honestly, like this is your education and this is your experience. So for the most part, just try honestly to, sorry, where am I going with this? For the most part, just I had a thought and I lost my train of thought there. But what I mean is like it's okay. Like no matter what they say on those evals, like you'll be okay, and you know yourself best, and you know where you're going with this. So just keep that goal in mind, and again, just like ground yourself in the fact that you're learning so much, and that inshallah, like Allah has your back, and it'll just work out how it needs to.
Yeah, definitely to echo what Manal said, like it can be a little exhausting to always worry about what someone is thinking of you. But at the end of the day, and going back to that self-care slide earlier, like it truly doesn't matter. And even like if you feel like it's going to matter for your evals and your shelf and all of that, like it absolutely does work out. And unfortunately, it's kind of like a trust the process thing, but it is like trust the process a little bit. Yeah. Really good thoughts from Safiyya. Awesome. Well, if there's no more questions, I hope you guys have a wonderful rest of your Ramadan, and please, like, we'll drop all of our information in the chat. So please reach out if you guys need anything at all.
Yeah, jazakallah khair to everyone for coming.
And then Diana, you can stop recording.